We are presenting a webinar today regarding mental health and women veterans. So we're going to have a variety of topics that we're going to cover in this call. Let me remind you, please mute your phones though. You can make sure to mute those either on your GoToMeeting software or by pressing *6. Then we can make sure we limit the feedback and reverberation so everyone can hear us. So I'll start by welcoming our three presenters today. We're here with Derek Felton, who is the director for the Peninsula Vet Center. We're here with Jamie Jones, who's the manager here at the California Department of Veterans Affairs over our Special Programs Unit, and Lisa Roybal, who is the Women Veterans Program Manager for the VA Loma Linda. Today we're going to talk about women veterans and mental health. We're going to cover a little bit about programs that go on throughout the state regarding serving women in mental health, and we're also going to give some resources to women who may be wanting to have their mental health needs addressed through different programs or who may need services right away. And then we're also going to talk a little bit about soliciting some feedback from the larger women veterans population and how the state can better serve our mental health needs. So with that, I'll go ahead and get started. My name is Lindsay Sin, Deputy Secretary for Women Veterans Affairs here at the California Department of Veterans Affairs. This is part of our bi-monthly webinar series. Every other month, usually on the first day of the month or first Monday of the month, we put on a webinar series at 10 a.m. And you can find past recorded webinars from our website. That's at calvet.ca.gov/womenvet. And then if you go to our Around California tab, you can see our past recorded webinars. We have another webinar scheduled for July. We'll let you know what the date and time of that webinar is going to be. Our topic is likely going to be women veterans and housing, but we'll give you some reminders through our listserv and post it on our website about our next topic for mental health or for housing in July. Couple of announcements. There is a council that was formed last year. It's the California Women Veterans Leadership Council. This council's purpose is to advocate for the needs of women veterans throughout the state and to improve services and share information and events. It is comprised of women veterans who are volunteers to serve on the council. We, because I'm an advisor to the council and because the council makes recommendations to me directly, we are looking for more members. We are looking to adopt and approve our new bylaws. And if you're interested in serving on the council, I really encourage you to check it out. We can send you more information if you email us at womenveterans@calvet.ca.gov. We'll be happy to get you more information about this council, who's currently sitting on it, and what the tasks of the council and the mission of the council are. So we are looking for members and would really like to encourage women to apply and join the council. We're also planning to, later this summer, present a much larger training on mental health issues and women veterans. That'll be happening sometime in July or August in partnership with Swords to Plowshares. That will also be a mental health webinar and training that is available for continuing education units in certain fields of social work and perhaps mental health. So look for information on that coming in a little bit, probably announced sometime next month. And then we will be opening this call up for questions and answers towards the end. So if you can hold your questions towards the end of the call, we'd be happy to get to them. If you're on our GoToMeeting software, you can also ask a question via our chat window, and then we'll get back to you during the call for that as well. So to start this off, we definitely are aware, as all of you who are on the call, that women veterans and veterans in general experience mental health issues or serious mental illnesses at rates that can look higher than the general population. As it is, for veterans and non-veterans alike, about 1 in 5 adults in the U.S. experience a mental illness in a given year. That's about 18% of the population overall. And 1 in 25 adults experience a serious mental illness about once in a given year, and over 20 million adults with a substance use disorder. Of that, over half of them have a co-occurring disorder and mental illness. So that's the general population. And then when you get down to women or to veterans in general, we know that anywhere from 18 to 22 veterans, male and female, commit and complete suicide in a given day. And that women veterans are at greater risk over their female non-veteran counterparts in committing suicide as well. So we have some really intense and I would say intense topics to discuss here today. I hope that we can discuss this in a manner that provides resources and some education to people. If you yourself are experiencing crisis or need mental health services and interventions, then we recommend you call us offline. You can talk to us at 916-653-1402. We also recommend you call the Veterans Crisis Line, which is 1-800-273-8255, and then press the number 1. You can also call the Center for Women Veterans with the USDVA, which is 1-855-VA-WOMEN. So to kick this off, we're going to go to our next slide and talk a little bit about some of the challenges that women veterans have in terms of their mental health and mental illness. So unfortunately, the rate of suicide among female veterans is 18.9 per 100,000 women, and that's compared to 7.2 per 100,000 among non-veteran women. So our risk of suicide is 2.4 times higher for women veterans than it is for women civilians. If you've read the news over the last year and a half, 2 years, the VA has come out with new reports on women veterans and their risk of suicide, and unfortunately that seems to be much higher, as the statistic states, and potentially increasing for women veterans. Additionally, we know that PTSD and major depressive disorder are the two most prevalent service-connected disabilities for women veterans, according to U.S. Department of Veterans Affairs reports. And we also know that military sexual trauma and the experience of sexual assault or rape are often more traumatic than in the civilian context, and are often the underlying symptoms of causes for things like homelessness among women veterans. This is the latest report released from U.S. Department of Veterans Affairs for 2015 data, showing that post-traumatic stress disorder and major depressive disorder are the two primary service-connected disabilities for women veterans, and that goes above other body systems that they're also filing claims for. So what are the implications and the consequences of high rates of mental health illnesses and issues among women veterans? Well, we know that there are strong connections between post-traumatic stress, depressive disorder, and unfortunate outcomes. So for instance, reports have shown that among women who served in OEF, OIF, and OND, so that's Operations Enduring Freedom, Iraqi Freedom, and New Dawn, women veterans had higher rates of moderate to severe pain, higher distress after the first deployment, and then if you added that with combat experiences, they also had higher rates of eating disorders and extreme weight loss. So there are physical implications, physiological implications outside of just mental health here. Additionally, women veterans who are pregnant and experiencing PTSD have also been linked to adverse pregnancy outcomes, which can include, unfortunately, spontaneous abortion or preterm contractions, preterm labor, and for infant outcomes can also include lower birth weights, as well as preterm delivery. We also know, as I mentioned earlier, that there are high correlations between military sexual trauma and experiencing homelessness among women veterans. And those that did experience homelessness, those stats have tripled in the last 5 years, ending with fiscal year 2015 among women veterans. We know that the national rates of homelessness among all veterans are decreasing because of unprecedented investment by USDVA and communities and states and cities into ending veteran homelessness. However, rates for women veterans for being unstably housed and homeless are not necessarily decreasing at those same levels. And so among women who are homeless, 45% screen positively for anxiety, 72% report being diagnosed with depression at some point in their lives, 74% screen positively for PTSD, 32% struggle with substance abuse, and 57% present with a health-related issue in addition to those. And so what we'd like to do here is really discuss how the California Department of Veterans Affairs, how our cities and our counties can better address mental health services for women veterans here across the state, how we can look at building new ideas and make sure that we're supporting the needs of our women veterans and their mental health needs here across California. So with that, we're going to talk a little bit about some of the programs that do currently exist. And then at this point, I'm going to pass this along to our first presenter, who is Jamie Jones, the manager over our Special Programs Unit here in Calvet, and she also oversees the Mental Health Services Act grant program. We also have the analyst that works in her unit, Philip Leggett, who's with us as well, to discuss Prop 63 and the Mental Health Services Act. So Jamie, I'm going to go ahead and pass it along to you.
Hi, I'm Jamie Jones with Calvet, Special Programs Manager. You kind of caught me at a good time. Phil and I just awarded all of our new grants for the 17-18 fiscal year. We'll go over that in a minute. But if you don't know, Prop 63 was enacted in 2004. It's essentially the millionaire's tax, so 1% of income goes to mental health issues. Calvet gets $270,000 of that to disperse to counties throughout California. It is a competitive grant process. This year we had 20 counties who applied for a grant. Unfortunately, we only get $270,000, so we were only allowed to award 7 counties. Phil and I are actually working on a plan right now to get more funding. But as you can see, Prop 63 provides an opportunity to expand county mental health programs for all populations, children, transition age youth, adults, older adults, families, and especially the underserved, including women. The program goals encourage early intervention of mental health needs for veterans and their families, provide timely and effective referrals to the appropriate service providers. One of the things that the counties are really trying to do and who we award is they want to reduce the stigma of mental health. They realize it's a huge problem and they're really doing what they can to stop that stigma. Do you have anything to say about that, Phil?
Like you said, this year we're going to focus on mental health that for transitioning service members, veterans, and their families. And we also want to focus on justice-involved veterans, including criminal diversion, veteran treatment court, and incarceration.
The counties that we awarded previously, as you can see on the map, we try our best to do this throughout California. We really, there's a lot of mental health issues in underserved population in Imperial. And we always try to give them a grant every year. Something I want to call out is Sonoma County. Their specialty is military sexual trauma. They contract through a company called Verity. They've consistently got a grant award from us every year because of the work they do with military sexual trauma, especially with women. It's one of I think the most successful programs in California. Like Phil said, 17-18 we changed it's still mental health, but we really wanted to work on transitioning veterans to ensure that they are transitioned correctly through DOD, but also as part of our new CalTAP program. Lindsay, I don't know if you want to expand on that at all, but we're trying to make these services go hand in hand, CalTAP,
Sure.
Mental health.
So in 2016, the California Department of Veterans Affairs was funded to, through a mandate through the legislature, funded to provide transition assistance programs and curriculum to veterans or to service members here in California who plan to make California their home. And that program will be instituted and implemented in a variety of ways through online-based training, through in-person training and classes, and can be accessed by all veterans here in California or their family members really at any time during their transition from the military. So that can be whether somebody is coming out of the military in 6 months down the road, or it can be for somebody that's been out of the military for a decade or 2 decades. There will be information for everybody within that curriculum and that program. And so right now the team is all on board. We have 7 staff who are part of the CalTAP program now through our Veteran Services Division, and they are actively working on writing the curriculum for that. They are also working on identifying stakeholders and partners throughout the state that they can both learn new information about what needs to be in that curriculum and look at deploying it. And so part of that will include addressing justice-involved veterans as well as mental health services for male and female veterans where it's needed. So that will be kind of a component, and there will be a connection with this program that Jamie runs as well.
Just really quick, I wanted to let you know the counties that are being awarded funds for 17-18 fiscal year. I already touched on Solano with the Retaliatory Sexual Trauma Program. They will be receiving funds again this year. I'm sorry, Sonoma. Solano County, they are justice involved. It's kind of exciting. Phil and I have been invited to sit on a roundtable with the judge and district attorney in Solano County to choose the veterans that they want for a veteran treatment court so we can be there throughout the process. It's really exciting that we can get involved from the ground up and see these veterans transform. And that's it. That's it for me. If you have any questions, please feel free to reach out. And Lindsay can give you my contact information, and I'd be happy to talk to you. And if there's any counties that you work with in California, I can give you connections for our grant program and for what they're doing exactly for mental health and Prop 63.
And so Prop 63 is a much larger program that every county has a plan in place to help administer and funnel those dollars down to their residents through different programs, and that does include beyond the money that we administer to in a smaller grant program to our counties, to the county veteran service offices. The bigger portion of those dollars goes through counties and still aims to address all residents of that county, and that includes veterans. So there is a larger pool of money out there that also works to provide services directly to veterans and their mental health needs at the county level. There's also the Mental Health Services and Accountability Act Oversight Commission, which was legislated and mandated to be created with the Prop 63 fund. And so they oversee how those dollars are being administered down to the county level. And they also administer different types of grant programs that includes some services and cultural competency training, et cetera, to about veterans in those counties. And so all of that you can find if you look up Prop 63 or Mental Health Services Act, you can find out more information on the website for that. So now we're going to talk a little bit more about what U.S. Department of Veterans Affairs does in the space of serving women veterans in their healthcare facilities, and some information about how that's done for mental health services. So Lisa, I'm going to go ahead and turn the presentation over to you now. I think it'd probably be easiest if you just have me forward the next slide over. So Lisa, if you can just say, hey, next slide, I'll go ahead and I'll just go ahead and forward your slides over if that works. So now we're going to turn this over to Lisa Roybal, who is the Women Veterans Program Manager with the VA Loma Linda Healthcare System. Lisa is also a veteran herself. So Lisa, welcome, and go ahead. And make sure to unmute your phone, Lisa. 1 second. Lisa, are you there?
Yes.
Okay, great. Okay, we're ready for you. Go ahead. Did we lose her? Did we lose you, Lisa? I think we did. Okay, so we'll go ahead and, Derek, are you on the line?
Yes, I am.
Okay, we're going to go ahead and kick it over to you, Derek, and then
Okay.
we will come back to Lisa. So let me go ahead and forward our slides a little bit here really quickly. Lisa, just let me know when you're back on the line. Okay, so we're going to go ahead and introduce Derek Felton, who is the director for the Peninsula Vet Center, and he's going to talk a little bit about vet centers and what services they can provide. He may be specific to the Peninsula Vet Center, but we'll be able to probably cover more in general about what vet centers do. And then just a reminder, folks, to mute your phones so we can limit the reverberation and feedback. Derek, go ahead.
Thank you. So the Department of Veterans Affairs has a unique part, which is called the Vet Center. And so we actually started in 1980 by Vietnam vets. And what it was that the Vietnam vets that were coming back were having problems accessing care to the VA hospital. And so what they did was they started meeting with each other and they started these storefront workshops. Congress got wind of that and thought that was a great idea. What better way to reach a veteran than by a vet? So they took these same Vietnam vets and they made them readjustment counselors. And so I want to get into some of the unique things that we do as vet centers, and then I'll get into what I call our FAQs, which are frequently asked questions. So what we do at a vet center is we provide individual counseling, group counseling, marital and family counseling, bereavement, also military sexual trauma counseling. So what are some of the unique things about a vet center? So I'll start off with our first, which is our staff makeup. We're mandated that at the clinical team, every vet center has to have at least one person that served active duty during wartime or peacetime. And so the team is usually made up about roughly between 6 to 10, and that will be a vet center director, the clinical team, an office manager, and some vet centers have an outreach worker. Our hours of operation, we're open Monday through Saturday, and most vet centers have evening hours up to at least 8 p.m. And so as I cover, I'm going to be talking about the vet centers in general, but all vet centers are pretty much the same type of atmosphere, community-based outreach. So who is eligible for services at a vet center? So any person, this is male or female, that has served downrange, and this is anyone that's been deployed. Doesn't mean that their MOS was infantry, it just means that they had to be deployed. So this is a combat zone veteran. MST survivor, this is from day one throughout their entire career. If anyone experienced military sexual trauma or harassment, they're eligible for vet center services. Bereavement, drone operators, direct rescue, mortuary personnel. So anyone that's been deployed is automatically eligible for vet center. One of the things we talk about is will you make me take medication or give me a prescription? What we do is what we call talk therapy. Now we work closely with the VA hospital for referral, but we're just sitting here and what we're trying to do is allow that veteran to tell his or her story. I didn't get an honorable discharge. Can I be seen at the vet center? Absolutely. The key thing here is if you've been deployed, does it matter about your discharge? And sometimes your discharge could have been related to a traumatic event that occurred while on active duty, and because of your behavior, that's why you got that discharge. You do not need to be service connected to be seen at a vet center. All services are free. Is there a time limit on how long I can see a counselor? No. We've had vet centers staff that has been seeing veterans for over 5 years, and this is part of that readjustment counseling. What other services are available through a vet center? We have lots. Not only do we do the individual counseling, we have groups, and we also do referrals out to our county veteran service office to help veterans file for those claims. What should I do if I need help after regular business hours? In addition to what the VA has, which is their crisis line, the vet center has a call center that's located out of Denver, Colorado, and that staff is male and female that have been deployed 24 hours a day, 365 days a year. So a veteran can call at any time, and that staff will talk with them, They'll get online and look at the nearest vet center that that individual is calling from and make a referral to them. I'm a survivor of military sexual trauma. Do I have to prove it to get counseling? No, that's not what we do. We're not into the investigation part. Any male or female that approaches the vet center and say that they have experienced MST, right then, that makes them eligible. The clinician staff gets with them, and what we do is support them. Now, if they want to file a claim, in addition to that, we're going to walk them through that process along with their CVSO officer and support them. I would like more intensive care, like residential treatment. Does the VA vet centers work with that? Yes, we do. By doing individual counseling at a vet center, because it's outpatient, that makes that person a little bit more prepared to do the type of residential treatment that the VA requires, that more of that group setting. And so, yes, we make that referral, and it's a two-way street. How do I make an appointment? You can go online and to vetcenter.va.gov. We have an interactive map. You just type in your zip code, and it's going to pull up the nearest vet center to you. There's 300 vet centers in the United States, including Guam and the American Samoan Islands. Can my family use the vet center? Yes. We actually provide counseling, support counseling for dependents of veterans. I'm still on active duty. Can I use the vet centers? Yes. The vet centers have a mandate through Congress that we can provide readjustment counseling to active duty members. My particular vet center, along with the Oakland Vet Center and the Concord Vet Center, we provide readjustment counseling at Camp Parks. We're on the grounds. We have an office to meet those men and women right there. We also have a working relationship with Moffett Field down in Mountain View. We have over 30 mobile vet center units, and these are RVs, so to speak, that go out into the rural areas and provide services to veterans who won't come in. We use those vet centers as a big advertisement for us. So we're at the colleges, any veteran holiday, we're there. And so it's a great way to provide individual counseling to veterans right there on the spot. We also have been called for any type of emergency crisis. Our vet centers are able to be loaded on a C-130, fly in, and hit the ground running. One of the last things that I want to talk about is our confidentiality at the vet center. So some have been wondering, like, well, it's my understanding that the vet center can access the VA healthcare system, but the VA can't access the vet center records, and that's correct. We are mandated by Congress to keep our records separate and confidential. And that's a uniqueness for us, and the reason why is because sometimes we find that we're meeting veterans who what we call have high-profile jobs. So these are veterans who have law enforcement background, the medical field, and some are even VA employees. And so coming to counseling is a little challenging, but if they know that their records are separate, then it's a little bit more of a relationship that they're feeling very comfortable that the counseling will stay right here. And that comes in handy, especially with military sexual trauma. Certain vet centers have different access to their vet center. My particular vet center, we have a separate corridor that if an MST survivor came in, they did not have to come through the front door and be overwhelmed with anxiety. We have another way for them to come in directly to see their vet center counselor. And that's my presentation, Lisa.
Thanks, Derek. We appreciate hearing more about our vet centers. So that gives people an idea that within the community, families and service members and veterans can access their local vet center to seek services on a variety of mental health topics and counseling groups, et cetera. So I'm going to go ahead and turn this over to Lisa Roybal now for her portion of the presentation. Can you hear me? I can hear you, Lisa. Great. So let me go ahead and back these slides up to your presentation.
Wonderful.
And we will start that in just a second.
Well, I'll go ahead and get started with go ahead and move to the next slide. I want to thank you for the invitation to talk to you about women veterans and what we're dealing with mental health issues. The VA is seeing women of all ages. Nationally, we're seeing over 700,000 women using VA healthcare services. And one of the things that we really want to understand is that women veterans are increasing the percent of patients who are entering the doors of the VAs. And we also want you to appreciate how women are served. And we also know that they're unique in both as a group, but more importantly, as an individual. So you can see here on this age distribution slide, I really wanted to show you this because you can see here that we have a very large peak between the 20s and 30s. Now, this is our prime childbearing age women, but we even have a larger peak at the 50 to 60-year-old. We have a smaller peak. We're still taking care of our geriatric women, and that is somewhere between the 80s and 90s. So our women are surviving and living longer, and so we want to make sure that we're taking care of their needs. Next slide. We all know that the military life for women has changed. The roles are changing. They're serving in combat units. They're exposed to unpredictable warfare. They have the daily operations of all the gear that they have to wear, the ceramic vests that aren't built for women's chests, the extreme temperature. Think about the hygiene issues that they may have to deal with out in operations. And of course, Lindsay mentioned the exposure to military sexual trauma and having to continue to serve along there, maybe potentially their perpetrator in their own unit. Next slide. I'll talk a little bit more about military sexual trauma as we continue. But I think it's really important that we all know, no matter where we're at in the community, whether we're serving at the VA or we're a community partner in an organization, you want to talk to women about their military experience. You want to know when and where did you serve, and what did you do. So they may tell you they were a cook, but if you ask them actually if they were in theater, what they actually did, they may have told you they had to guard the perimeter. Ask them about their military service, how that affected them, and did they have any exposures, and did they ever come close to proximity to any blasts? Next slide. So when the veteran answers yes to any of these, you want to do that follow-up question. You want to tell me more about that. You know, did they see combat, enemy fire? Were you or colleague wounded or hospitalized or injured? Were you ever became ill while you were in service? And of course, the prisoner of war. We don't want to just exclude that only for our male counterparts. Next slide. So why is this important to ask these questions? Well, you want to acknowledge that military service is a part of that individual's life. You want to relay the message that it means a lot that they're a veteran and what they did to serve. You appreciate their sacrifice. But you also, it brings you to the forefront to pay attention to the ways in which their military service might affect their current or even their future health. Next slide. But here's more importantly, when you ask those questions, you may prevent that family breakdown. You may prevent that social withdrawal or isolation for that woman veteran. You can prevent those problems with employment or maybe abuse of alcohol or drugs. Prevent suicide, just wanting to know more and asking her to share. And we want to break down those barriers and reduce stigma. Next slide. So Lindsay mentioned you saw the top 10 diagnoses were 2 mental health diagnoses. Well, look at these staggering numbers for the mental health diagnoses of our females who were in the OEF, OIF, and OIND eras. You know, adjustment disorders, non-dependent substance abuse. These are numbers that we can't ignore. Next slide. Really with this slide, I just want to try to explain that adjustment disorders or adjustment to military life and their exposures, it may be a normal process, but when we get concerned is when this distress lasts more than 6 months. They may develop symptoms of anxiety, depression, and this may develop into a disorder. They also have disruption of their employment, their school, and more importantly, the relationships of the people they have around them. Next slide. So Lindsay talked a little bit about the PTS rates, and as you can see here, you know, there are high numbers of our latest era of women veterans that served, and that women are twice as likely to be diagnosed. And they usually present with other comorbid substance abuse use. They have risky behaviors, and the re-victimization of maybe they had MST and they get re-victimized over and over in their units. Next slide. So, you know, we talked about depression, anxiety in women, that women are twice as likely to be diagnosed with depression, but two in three women are women veterans have generalized anxiety. These are women. I mean, two of three, that's a high number. And then women are diagnosed with panic disorders 2 times more likely. Next slide. So we touched on military sexual trauma. We've got a quarter of our women, that's, 1 in 4 women say yes when they're using our VA facilities about military sexual trauma. And I want to make sure that you understand that it also includes harassment and not just assault or rape. And so we want to be cognizant of those women who are over and over sexually harassed. Next slide. So MST is associated with increased suicide, major depression. So you see down the left-hand side, you see those social interruptions of those women that have experienced MST. But look at the medical side. On the right-hand side, they have asthma, breast cancer. They have more ischemic heart disease, obesity. So these women come with many, many other problems that we need to address. Next slide. So in our post-deployed reintegration stressors, you can see along the continuum that women can experience any one of these disruptions from isolation to maybe housing and finance. And Lindsay talked a little bit about our numbers of our women that are increasing with homelessness. We need to pay attention to all of these on the continuum because at any point they may have 2 or 3 issues going on with these coming back and readjusting to civilian life. Next slide. So resources within VA, we have OEF, OIF case managers at every facility, women veteran program managers at every facility. Your MST coordinator, anybody that's calling into any of the call centers at the VA should be able to identify the military sexual trauma coordinator. We have a national center for PTSD. It's a great website. If you haven't explored that, I encourage you to. We have suicide prevention coordinators. And of course, we partner every day with our vet centers. Next slide. I wanted to talk a little bit about this care manager, this OEF, OIF, OND care manager. They're here to assist planning and problem solving. They help with housing, any legal problems, employment, and they even help get you, the veteran, to health issues. They help and coordinate the assistance with other VAs or other community agencies. And they support that not only for the veteran, but the family member. They help you and the veteran get in, attain your goals and regain and maintain that self-sufficiency. So that's just a little bit of a picture of where we are for our women veterans nationally and what we're doing for mental health and what our resources are in the VA. If anybody ever has any questions, I'm available by phone. I'd be able to help any women even nationally. I'll get them in touch with their the right resource in their area. Thank you for your time.
Thank you very much, Lisa. That was pretty comprehensive in terms of what can be offered at U.S. Department of Veterans Affairs VA medical facilities, in addition to Derek's presentation about what the community vet centers can offer. So we wanted to provide a few more resources for women veterans who are potentially experiencing mental health issues or need to identify additional resources in addressing whether it's counseling or professional services. So we have a couple things that we found in our research. One is a veteran self-check quiz. This is allows you to chat with the VA directly. They will leave a personal response within 10 to 15 minutes. This is in addition to calling their hotline numbers and their crisis numbers. You can also do the self-check. It's www.vet, that's V-E-T, selfcheck.org/welcome. There's also mental health screening tools that can be utilized by individuals, and this is these help with if you're looking or suspect that you may have a mental health issue that you think maybe you want to take a step further and get services for. They have tests for depression, some screening tools for anxiety, bipolar, PTSD, etc. And this is with Mental Health America. So this is www.mentalhealthamerica.net. And then from there, you can look at their mental health screening tools. We have not vetted these a great deal, so we looked at these and took some of them ourselves. but beyond that, did not go further to contact the organization. So we're just trying to throw out some additional resources, but primarily for your own research. And then, as we shared earlier, there's the Veterans Crisis Line at 1-800-273-8255. There's also the Women Veterans Call Center line to ask a variety of questions about healthcare delivery of services or mental health services or Veterans Benefit Administration benefits. You can call 1-855-VA-WOMEN. Additionally, if you're looking to connect with the Women Veteran Program Manager at your local VA medical facility, you can find that both from our website at calvet.ca.gov/womenvets, and then look under our healthcare link or tab, and you can find the program manager in your local medical center. If you are needing to contact any of these other referrals, we've got the Safe Helpline on here. We've got the Sexual Assault Response Coordinator's Office for the California National Guard. There's additional resources at Military One Source. And then we've got, if you're looking for free or low-cost mental health counseling services as a veteran, you can also look at the Soldiers Project, which is thesoldiersproject.org. So what we've talked about in our discussion, just to wrap up some of the comments and then open this up for questions, we've talked about what the state level Mental Health Services Act program and what we administer here at the department has. We've talked a little bit about U.S. Department of Veterans Affairs, their mental health programs at the U.S. VBA hospitals and clinics, as well as our vet centers. There are also national organizations such as what I've just pulled up on our webinar as NAMI, which is the National Alliance on Mental Illness. And there are lots of nonprofit organizations out there. One would be the Soldiers Project. There's also counseling offered at a variety of housing and service provider projects in the nonprofit space that offer counseling on site. There are also university programs such as the UCLA Nathanson Family Resiliency Center down in Los Angeles. There's also in Los Angeles the new Cohen Clinic that's just opened up that's providing services to veterans in the areas of counseling, etc. There are really a variety of services out there that a veteran and family members can access. That said, I'm sure there are also gaps. And so what we'd really like to know is, where are those gaps? Where do we, as a comprehensive system of service providers, need to do a better job in addressing mental health for women veterans? As we know, there are serious numbers attached to issues of mental illness and mental health for women veterans. So we know there's still gaps. Right now, there is a bill in the legislature. It is AB 1618. This is a state bill. The author is Assemblymember Cervantes, and it is asking Calvet to create a task force on healthcare for women veterans and specifically look at mental health needs of women veterans. There's also a federal bill that was introduced. This is the Deborah Sampson Act, and this was introduced by Senator John Tester, I believe is the correct author. And this is asking VA to expand services to women veterans in all areas of healthcare delivery. So both of those are something to look out for in this coming legislative year to see how they do and if they pass. Either one of those at the state level or at the federal level would be looking at how we're expanding services to women veterans in the space of mental health care. And so if you're interested in providing us feedback and giving us more information about where you see the gaps and where they exist and how we need to address them, we're looking for ideas. So you can contact us at womenveterans@calvet.ca.gov. You can also call our line directly. It's 916-653-1402. There's our contact information up on the webinar. And now we'd like to open it up for some questions. If you can, please ask some questions either via our chat window, or if you want to ask them directly via phone. We're going to wrap this call up around 11, so we have about 15 minutes. I think we can definitely field a few questions. So go ahead, any of our listeners, if you want to ask a question, please feel free at this time.
Hi, Lindsay. This is Rebecca Stoller from Mayville VA Women Health.
Hi, Rebecca.
Hi. I'm glad that resources really good, and you just list out the website. And also I want to just briefly share at Mayville Women Health we have a comprehensive comprehensive women social work program here. We have our holistic care. We also have women support group helping women veterans get jobs. And like what you said, that the veterans have MSC to have all these challenges. We have all these social work services to help the woman. Plus, I want to update at Women Health Mayville Clinic, we have integration mental health services. We have 2 mental health social workers on Tuesday and Wednesday do the intake and see veterans at Women Health Clinic, a safe environment, a whole day, Tuesday and Wednesday. We also have women like recovery group. Plus, we do have 2 women big events in Concord this year, June, and Sacramento. Give a lot of resources to the women veterans. So we try to serve the women veterans too.
Wonderful. So Rebecca, thank you for your comments. Rebecca Stallworth is the social worker over at Mather VA Hospital. That's the Northern California VA healthcare system. And so what Rebecca's speaking about is that Mather has integrated its mental health services with its women's clinic. Lisa, is this the case down in Loma Linda VA? Are those 2 integrated fairly well?
Yes, they are.
Okay.
Yeah, so we have the same kind of setup that Rebecca has. We have the integrated mental health within our comprehensive women's health primary care clinic.
Okay. And so it sounds like, Rebecca, there are screening processes happening weekly on Tuesdays and Wednesdays. Is that correct? Is that what you said?
Actually, the veteran set an appointment to meet 2 female social worker mental health. They do an intake for the first step, get to the mental health services, and the mental health social workers see them at Women Health Clinic. It's a safe environment, so they come in. You won't see men in the lobby. They receiving individual counseling. Plus, one more thing I want to add is that because women have MST, some they may not ready for therapy immediately. We do have the Tai Chi yoga, massage, and energy healing, helping the woman get ready for the talking therapy down the road, and we're successful. Just so you know that we focus on that area, helping women to move into talking therapy.
Okay, thank you. Yeah, so there are additional services that the US DVA hospitals are offering, including Mather, that could be therapeutic services, not necessarily focused on just counseling or therapy with a therapist, right?
Thank you.
And so, so that really covers a lot. We've talked a lot about U.S. Department of Veterans Affairs services, understanding that not everyone qualifies for those services. So does anyone have questions related to what community services are often offered outside of USDVA, or comments regarding that? We're ready for our next question or comment. Okay.
So, Lindsay, this is Lisa Roybal. You know, I really encourage people using their county mental health departments. I know that a lot of that's income-based, but when I do find I get a female in here and eligibility can't take care of her, she's not eligible for health care services otherwise based on our eligibility laws. But I use the county, and I find out where they're at. I get the county phone number for them, and a lot of times, if they're don't meet the criteria for the county has additional resources. So I always start at the county.
Okay, so that's a really good comment, Lisa. I appreciate that. The county mental health services, the counties are required to offer veterans mental health services just as because they're residents of that county, regardless of their veteran status. They're asked to address a veteran's status and issue at that time, as opposed to turning them away or turning them to a VA hospital first. So people should be able to access services within their counties, absolutely. And that can happen a variety of ways. There's county departments of mental health that people can look up. There's the 211 service that people can call and look at services that way. And then we'll also connect someone with those types of services as well. And so I'm looking at a few comments from our website. Lisa, maybe you or Rebecca could focus on this one. This is looking at when there seem to be funds available for mental health therapists, but they don't necessarily end up coming to fruition. So perhaps at one time there were funds for more mental health therapists or more counselors at a community clinic, but then the funds are not developed, or it doesn't happen that they're hired. Is there any way that can be addressed? You know, do people need to go to the medical center director to ask about that? Do they need to kind of inquire how to get more? How do people ask for more resources within their VA system for more therapists?
I would say yes. They need to probably go to their medical center director in Santa Ana. I believe that's West LA.
Yeah.
And, you know, if I really encourage people, if there's no services seem to be lacking or there's none of it, you know, I really say you need to be talking to the director. The veterans, the more the veterans speak up and speak out, the better the directors will know the current issues that are out there for especially our women veterans.
Okay. Wonderful.
Yeah, I totally agree, because I always encourage the women veteran when they come to Maple VA Women Health, get all the services. They fill out the feedback form and kind of like share what they think what will be the women veteran need, and then they fill out the feedback form. And the feedback form will go to the patient advocate department, and then will go to the administration. So when the woman need to voice the opinion, see what they need, what they need more to help them get better. So the voices are very important.
Okay, so feedback form through patient advocacy is another resource for that?
Yeah, because the feedback form is available at different departments. It's in one side, the green color. You just write down what you think and what you need, and then I would turn into the patient advocate. They will gather all the opinions, the feedback from the vet. That's one way to communicate with the administration.
Okay. So we've got two suggestions. Talk to medical center director and go through patient advocacy with the feedback form as well when you're looking at ways where you want to see or you believe there needs to be an increase in the funding or the staff that are available that are seeing patients in terms of the mental health space. And likewise, there is a mental health oversight commission at the state that looks at how that delivery is happening at the county level. And so you can contact the Mental Health Services Commission. It's Mental Health Services Act Accountability and Oversight Commission. You can contact them for more information on how that should be working in your county. You can also go to your county mental health program, and then you can contact us, and our contact information is on the screen again. So really, we're looking for more feedback from everyone, from our callers and women veterans who are utilizing some of these services. We want to know where we can make the most impact to help improve services to women veterans and their mental health needs. And so again, I encourage people to look at the California Women Veterans Leadership Council as a resource. And if you do get involved in this council, there is a task force that's been formed specifically looking at healthcare. And that includes mental health care and how women veterans are able to utilize it, where the gaps are, where improvements need to be made. We're going to take those recommendations very seriously and see where we can improve these services for our women veterans here in California. And so if you're interested in information about the council, if you want to contact us about future webinars or content that we delivered for today, please get a hold of us. It's womenveterans at calvet.ca.gov, and our number is 916-653-1402. We've had a couple questions through our chat window, so we'll do the best we can to answer some of those individually. Anybody else have questions about about what our topic today? I see that we do have information. So the bill that I mentioned about the task force with Assemblymember Cervantes is AB 296 to answer that question. Okay. Any additional questions today that we can get to via the phone? Well, as a reminder, we will have another webinar ready for you to participate in or ask questions and listen to. That'll be happening July 10th at 10 a.m. So please look for the call-in information for the next webinar in July. The call-in information in terms of the phone number and the password are likely to change as we are getting our own GoToMeeting account that we don't have to share with the rest of the department, just so we don't have logistical issues. So we've had a few of those in our past calls. So definitely please join us for our July 10th call at 10 a.m. And you'll see information published about that soon. And then, you know, please feel free to contact us. I'd like to thank our presenters today, Lisa Roybal, Derek Felton, Jamie Jones, and Philip Leggett for joining us today. And this call will be available to view and to listen to on our website. We post it within about a week from today, so you'll see that on our website again. And also look for, if you're interested in further training on mental health for women veterans, for continuing education credits, we plan to also host that sometime in July or August. And so you'll see more information about that training opportunity coming up as well. So I'm going to go ahead and wrap our call up now. Thank you so much for participating and calling in. We appreciate having you here today. And we hope you have a great week, and we'll be back with you in another month. Take care, everybody.